Okay, I'm going to show you a few soft tissue techniques for the cervical spine and sitting. I love to always have a little travel pillow that I got at Bed Bath & Beyond that is about the width of her shoulders. And that helps me keep her head in the neutral position, but also keeps my body parts off her face and head. So I'm going to start with a two-dimensional soft tissue technique. So I'm just going to cradle the head and neck so I can control it with this hand, and my caudal hand is going to be ready to grasp the cervical paraspinals. Now it's important that you try to touch the patient as little as possible. I don't want to be all up at her, thinking about my technique so much that I'm crushing her face. So try to open up your shoulders and touch the patient as little as you can. And then once I'm in this position, I'm going to gently grasp the paraspinals and pull them back to bend them to end range. So I bend them to end range, and right before my fingers slide, that's when I'll start stretching the muscles with flexion. With flexion, I want to not just move my arm down, but I'm moving my trunk into a side bend. I'm bringing my shoulder down, my elbow down, and a radial deviation. So it's a bend of the muscles, stretch to the muscles. There's end range. That's as far as I go. I give it a little 2-second hold. I'm going to start again. Bend, stretch. Bend, stretch. Bend, stretching. Each repetition, I'm going further to end range. Now, soft tissue techniques are going to help you warm up the muscles, get them ready to be pliable before I could do some joint mobilizations. So the muscles are almost always involved in any kind of cervical pain or disorder. So I'm always going to start with some soft tissue mobilization and make sure it feels good. So I always let the patient know if something doesn't feel good, let me know. And your patients are going to teach you how to have better hands. Then I can progress that technique. Let's say I want to do an extension technique coming up next. I'm going to come lower, and I'm going to push cranial lateral with my caudal hand, and I'm going to go medial caudal with this cranial hand. So as I turn her head, I'm going to have my hands go parallel to one another and wring out that muscle like a towel. And if you ever notice, sometimes your patients don't relax well. You know what doesn't work? Saying relax. So what works way better for me is saying, Lita, just turn your head with me. Help me out 5%. Even less, just 5%. And then I don't have to turn her, and she comes back on her own. So I don't need to use as much force. I don't have to hold her head as much, so I can barely touch her. Bend the muscle. Stretch the muscle to end range, making sure it feels good. You can also do that technique in a flexion pattern. So I'm going to rotate her away and allow it to couple. So now I'm going to pull down with my caudal hand. I'm going to go caudal medial and then cranial lateral. So it's going to go like this. 1, 2, 2. Hold it for that 1 to 2 seconds to end range. Get to end range of the muscle. Give it that stretch and feel, while you're performing the technique, you're always assessing for that end range. End range of the muscle, give it that stretch. That feels the best. Your patient always has the right to let you know if something's painful. Last technique I'm going to show you for cervical soft tissue is if I want to emphasize the suboccipital muscles and I want to flex the upper cervical spine, cervical flexion is not my best way to do it. I want to retract the neck. So I'm going to say, Lita, bring your head backwards with me, and I'm going to radially deviate while she's retracting like a golf ball on a golf tee. So I'm going to say, come on, back and look down. Back and down. So I first teach her that motion, Now I'm going to grasp those upper cervical muscles and bend them, and then come back and stretch. Back and stretch. And think about it for your patients. What patients don't have upper cervical tightness of the joints, of the muscles? Not many. So almost all my patients with neck pain, I'm doing some kind of upper cervical soft tissue, and later on, the upper cervical joint mobilizations.